Now we invite Dr. MAHIPAL SACHDEV, who's going to talk about converting the patient to premium cataract surgery, and I think that is the wave nowadays. People require a premium IOL surgery, so why not to convert them in all one go? And I think he will be the best person to talk on this subject. Dr. MAHIPAL, sir.
Thank you very much, Professor Tityal. I'll be talking about it, understanding premium cataract surgery as to how to build it, tips and tricks. Well, as you all know that in recent years, phacoemulsification has changed the fundamental aim of cataract surgery from being a restorative surgery to a refractive surgery. That is something where we are looking at the patient's demand of the uncorrected visual acuity almost being similar to the best corrected visual acuity. And the name of the game has today become precision, has become emetropia, has become less dependence on glasses, etc. So that is what we have been talking about. And this is something that has evolved over time, and this is what we call today as the premium cataract surgery today. Now, when you are looking at premium cataract surgery, as has been said in the previous talks, you need to treat previous dry eye patients because they are going to be dissatisfied and your net promoter score for the patient satisfaction will go down. Corneal irregularities, etc., has to be seen, assess on the OCT that there are no macular changes which are there. And what is important is that you need to discuss the visual needs of the patient and the psychological assessment. So important when you're doing a uh, premium cataract surgery is to manage expectations. Expectations in premium cataract surgery, I will say in two parts. One is the flax, which is nowadays available, and the second is the IOLs, which are available. And these are the two things that you have to do. That femtocataract, you need to inform the patient that any surgical intervention has a risk of complications, but this possibly reduces the outcome. It makes it more, reduces the complications and improves the outcomes and makes it more gentle on the eye. And in intraocular lenses, the word I use always is reduced dependence and not independence on glasses. So it will be reduced dependence on glasses and not independence of glasses. That is what you have to tell. In today's world, these symptoms have come down, but you must always warn the patient of glare, halos, starbursts, etc., and that should be told to them beforehand. And therefore, counseling is a key when you are looking at premium cataract surgery. It is mandatory to counsel all cataract patients. Pick the pleasant, people-friendly counselors which are there. Impart technical knowledge to your counselors because they should be able to give the best advice to the patient, and allow them to see and understand the femto procedure as also what the premium IOLs are going to give, like a toric or a trifocal, etc., and provide them audiovisual tools which are there. Now, these are the two things. So these are premium services. Biometry, keratometry, topography are important. But when you are looking at the next step, you need to create a core femto team. That means people who should talk, breathe, speak, eat femto. They should be able to tell the patients that this is a better procedure, what are the advantages, etc. So that they must be knowing, and this has to start from the right from the optometrist, the first point of contact, even up to the OT staff that is there, and tell the doctors that they need to learn femto. So I think the learning curve is pretty short, which could be 10 to 15 patients. Now, when we started femto, I think it was priced obnoxiously high. It was 50,000 rupees pricing over our normal charges of cataract, which are about 40,000. So the delta was more than 100%, and that hit us. So under the present circumstances, we reduced the prices once we switched over to the catalyst system, and we got a reduction in the LOI price, and therefore we were able to price it right. And that is something which is very, very important. But before making any investment in this technology, you should decide whether you are convinced by this technology. You should commit yourself and your team, and then you have to make sure that you have to succeed. Now, the premium service has to be given as a 360-degree experience. This is a normal dhabe wali chai, and this is Nescafe comes there. But when you go to Cafe Coffee Day or Starbucks, there is a different experience, a different feel that you get. So therefore, a person who is coming in for a femto laser should be told which is the difference, what are the difference, what you want. Even the wow factor here of just holding the box of an iPhone is significant. So that is what the patient has to be done. So we make different discharge cards for them. We make them different places to sit. And what is very important is that when you have to start with a premium practice, you have to set goals, and what in layman term is called as gamify it. If your children get addicted to a video game, it is because they get points and they get prizes. So similarly, you need to gamify. What you need to do, set the targets that I need to do 100 femtos. We set targets of 100 femtos a month. Today we are at 600 plus femtos a month. But when you started the initial hiccups, we had to set targets and you had to gamify it and give rewards to the people that is there. And this is something very important, that net promoter score, that 0 to 6 are your detractors. That means after you have done a procedure, what does the patient talk about it? His experience has to be very good. And the people who are 7 to 8 are passives and the promoters are 9 to 10. So average net promoter score should be about 72% in the Indian healthcare industry, and that is what you need to have. You need to go back and see that your net promoter score of the patients who go out are very happy. You should know how to share the success. So this is our every time we change these numbers. So this was in March, we crossed 675 femto cataracts in a month, and therefore we celebrated that as a success. And you need to share the success. This is just overall thing for the counseling, which is very, very important, that you have to believe that the counselors have to be patient friendly and give tips, etc. You can even have recorded voiceovers. You may have kiosks where a patient can click and get more things out of it. Testimonials are very important. Information letter, thank you cards, patient feedback forms, etc. These are again things which adds the value to what services you are giving. But always remember, under promise and over deliver, because the wow factor has always to be more than what a patient came in for. So 5 pillars for a premium procedure would be patient selection and counseling, planning, biometry and astigmatic management, precision with technology, giving your patient a premium experience, promise less and deliver more. So these are the things which can give you the success that you want in your premium practice. Thank you very much for your kind attention.